Today, we are reporting one new case of COVID-19, which brings the total number of confirmed cases in Nova Scotia to 1,065, and we currently have 4 active cases in the province. Following contact tracing by Prince Edward Island related to their new COVID-19 cases, we were notified on Saturday that one of those individuals in PEI had been in close contact with someone who had recently traveled into Nova Scotia from the United States and was still here in Nova Scotia. We contacted that individual on Saturday and arranged testing, and their result came back yesterday, July the 5th, and they were positive for COVID-19. That individual is now being held under the federal authority at their local quarantine facility, which is out at an airport hotel. We are in the process of Nova Scotia Public Health of doing all the contact tracing to understand where that person may have been between June 26th when he came into the province and July 4th when he came to our attention. And we're continuing to work closely with our colleagues in both Prince Edward Island and the federal government as we follow up all these linked cases. As I said, this individual remains within the authority under the Federal Quarantine Act because they're within the 14 days of entering Canada. And so we'll continue to work with our federal colleagues around this case. We'll as we get more information on contacts, we may have to come back and do any public notification, but we don't have any conclusive information at this point. We know that in the last 24 hours that our microbiology lab at the QE2 Health Sciences Centre tested 178 Nova Scotians. That's typical. We see less testing on the weekend, especially on a Sunday. We still have no licensed long-term care homes in Nova Scotia with active cases of COVID-19, which remains good news. Our total numbers, we've had 55,113 Nova Scotians tested with negative results, and 63 Nova Scotians have died from COVID-19. As I said last week, that as we opened up in the Atlantic bubble, that I was comfortable saying there was no greater risk if I had traveled to another Atlantic province than if I traveled within Nova Scotia. I'm very comfortable with that statement. I know that people are concerned, though, however, about COVID-19 being brought in here from other provinces outside the Atlantic provinces or from countries from around the world. I understand that is our greatest risk, and that's why we need to understand what is in place at the border and what we're actively working on to strengthen those approaches. People need to understand that our international border is governed by the federal government and Canadian Border Services agencies. It's clear that in my conversation with them on Friday, they reiterated that Canadian citizens and permanent residents of Canada are legally allowed and have to be allowed to return back to Canada. That there are people from other countries that have immediate family members who are either Canadian citizens or permanent residents are also allowed to come to be with their immediate family. And there are some people who have jobs that make it necessary for them to come into Canada, even if they're from another country, such as diplomats. And then we have a small number of classification of essential workers that are allowed to move back and forth across our borders, particularly with the United States. And that's pertaining to the movement of essential goods and services that we all rely on, for instance, to have their food in our grocery stores, etc. However, under the Federal Quarantine Act, unless exempted for people such as the essential workers, any of the people, even if they're legally allowed to come to Canada, have to undergo a 14-day quarantine period. Certainly the case this weekend raises questions about people following those rules, and you heard the Premier speak about that, about how it's essential that people are relying on, we rely on people to follow those rules. But I also ask people to not make assumptions about what they may be seeing people doing. If you see American license plates, don't assume that the people are here illegally and that they haven't done their quarantine period. They may be there. Certainly, there's lots of reasons why people driving cars with American license plates can legally be here in Canada. There may be a Canadian resident coming back, and they may have done their quarantine period. The same when you see license plates from other parts of Canada. I think it's important that we don't jump to conclusions and then make negative assumptions about people. It's important that people know, as the Premier's outlined, that we're urgently working on implementing a tracking system for people coming into Nova Scotia from outside the Atlantic region, and we'll have more news on that very soon. But I've been on calls all today around the details of, and so there's a lot of people working very quickly to get that up and going. But I would ask Nova Scotians that if they see people that are here from outside of the province, be welcoming to them, talk to them respectfully about the public health rules that are in place for everybody who's here in the province, and it's important that we make sure that we're doing what we need to do before we look negatively at somebody else who we make assumptions about what they may or may not be doing. As I've said repeatedly, and the Premier said here at these briefings, that reopening our economy and society during this pandemic remains a complex balancing act. On the one hand, people do need to work. We need to have businesses opening and operating, and all of us need some form of social interaction and to be able to get together with each other. And if we have family members in other parts of the Atlantic Canada, it's important that we're able to get to see them. On the other hand, even with all these safety precautions that businesses, workplaces, and individuals are putting in place, this reopening does inherently bring an increased risk of COVID-19. We have to understand that. Again, it's this balancing that we have to open things up, which allows some risk. The way we control that risk we really have two options. We either shut things down again, which is not really an option that anybody wants or is really feasible or realistic, or we all follow the basic public health measures that we've used since March that allowed us to flatten the curve. We need to continue to practice those. I keep saying here, but I'll keep saying it again, we can't relax. It's not about going back to normal, which we were pre-COVID. We have to continue to be vigilant, and we rely on each of us to practice these basic preventive measures. That's what allows us to protect each other and allows us to continue to open things up and do that safely. We don't want to shut down again, but if we don't do a better job of all following these public health measures, we may end up in that situation. So we need everybody to continue to practice good hand hygiene, cough etiquette, staying home when they're sick, and most importantly, when we're out and about, maintaining that physical distancing wherever possible. And if it's not feasible to be sure about that, everybody wearing a non-medical mask. It's most important that any of our indoor environments, so if you're going into a grocery store, any kind of an indoor retail space, if you're going into a medical clinic or a hair salon, all of those are indoor environments where it's not necessarily going to be possible to be assured that you're maintaining that 6-foot distance. So we really need people to start to wear a non-medical mask in these indoor environments when other people are around. When you leave home, you should have a mask with you. Make sure it's ready and available, that if you do need to use it. So if you're going, you have it in your purse or in your pocket. And before you go into a store, before you get on a bus, before you go inside and drop your child off at daycare, those are places you should always put your mask on before you get potentially close interaction with other people in our communities. While the mask does protect other people, it'll also protect you in the long run. By wearing a mask, you're setting an example that masks are the norm, that we all need to be wearing masks. And as more and more people adopt that, we each start to protect each other. So ultimately, you wearing a mask sets an example, and other people start wearing a mask, and by them wearing a mask, they are protecting you. So it protects each other, but ultimately, what you do sets an example that allows other people to follow that, which then protects you. So I'm asking and I'm appealing to all Nova Scotians, whether it's individuals, families, business owners, employers, and employees. Please take this seriously. We need to continue to do all these public health measures, but the one thing we can do a much better job on is wearing non-medical masks when it's necessary. And again, all those indoor environments, when you're in public spaces that are indoors, when you're in workplaces where you can't be, where you have certain workplaces, you just have to be close around other people for prolonged periods of times. And when we go to gatherings where there's large numbers of people, whether it's indoors or outdoors, all of those are places where it's critically important that we start to do a much better job of all of us having a mask available and wearing it. It's important that we normalize this as quickly as possible before the second wave of COVID arrives. Once it's here, it'll be too late for us to get our mask wearing to the point where it needs to be. We need to adopt this now as a precautionary preventive measure as we move through the summer and prepare for a possible second wave in the fall. And the same goes for physical distancing. It's that combination of physical distancing and mask wearing, which are the most important. It's important we do everything, but those are the critical ones that will help us to control the spread of any COVID that comes into the province. We control its spread if we're following all these practices and keep them as sporadic, isolated cases. I certainly appreciate that people are anxious just to be able to get out and about, but and not have to worry about all these things. But that is part of our new normal. We have to respect COVID and do what we can to minimize the chance of a substantive resurgence, even whether it's in the summer or as we expect a second wave in the fall. Just want to, again, I'll finish off by reminding people that in our healthcare system, we're still maintaining capacity, and we're focused on ensuring that we have adequate access to anywhere in the province, to timely access to testing, enough capacity in the laboratory, and we're working to ensure we have the appropriate public health capacity for urgent follow-up. So the health system is geared up and doing the things that we need to do to protect the health of Nova Scotians. We need all Nova Scotians to do their part as well, and it's those combinations of the health system with rapidly detecting and following up cases, and everybody doing the personal prevention measures, that those two key pieces together are what's going to allow us to move forward and remain as open as we can.